As leaders, we tend to think that we should have the answer to every question and every problem that comes across our desk, which is not possible. Being able to take that time to work out how you craft the story is very important, and engaging people around you who potentially have a different view, because the best solutions come from collaboration.
Hi and welcome to Content Matters, where we go behind the scenes of content in high-stakes environments. I'm Natalie Koo, your host, and today I'm speaking with David Hoy. Now, David is Portfolio Executive at Amplar Health, and Amplar Health is part of Medibank Group. He works across hospitals, clinics, and community health to improve patient outcomes. During David's career, he's learned that leadership is built in small, human moments. Today, we're going to explore the stories that shaped him and what lessons we can learn around leading with courage, empathy, and trust. So, welcome, David. How are you doing today?
Thanks, Natalie. Thanks for having me.
Wonderful. I'd love to start by asking you, how did those early years shape your sense of meaning in healthcare and how you work today?
When I first started, I was a young 19-year-old straight out of high school. I was lucky enough to land a job at a local hospital. It was eye-opening to having never experienced a hospital or a healthcare services before, to all of a sudden be part of the team providing care to patients.
I think you recall working across all sorts of wards, but also the oncology ward, is that right?
Yeah, so the hospital I was working at had a large oncology patient mix, which meant that you saw the same patients throughout their journey and got to know them and their families.
Do you remember any particular moments where you were like, gosh, this work is really meaningful, or you felt really moved?
Yeah, I remember when I first started how daunting it was to walk into a patient's room. Despite feeling nervous, patients were always very happy to see you, and you're visiting them on their most vulnerable times. And most patients are warm, welcoming, want to talk to you. There was some patients that I really got to know well.
Did you ever receive any feedback that gave you an aha moment that healthcare is something you wanted to do for life?
Yeah, there was a particular patient who had a long journey at the hospital, and when I met this lady, it was about the same time that my grandmother had gone overseas to live. I was probably missing her, and I became very attached to this lady, and I would visit her before and after my shifts. Sometimes I'd even come in on the weekend to see her. During that time, I met her husband and her children. That lady eventually passed away. I was upset. One of the nurse unit managers said to me, I should be very proud of the difference I had made to her life in making her hospital stay more enjoyable. During one of her times where she was out of hospital, she bought me a wallet and had that wallet engraved with my name on it, and she gave that to me. So that was very special and something that's stuck with me for my whole career.
Has there been a time where you've ever felt like you've got it wrong?
Yes, one moment in particular sticks in my mind. I think I'd been in the job about 3 or 4 weeks, and I was taking an elderly gentleman in a wheelchair to see the oncologist. On the way back, he seemed upset and distressed. I asked him what was wrong, and he explained to me he'd had a terminal diagnosis. I said, it'll be okay. And he got very annoyed with me, said, how would someone your age and your fitness and health understand what I'm going through? It was a very uncomfortable conversation, but what it did teach me is to be very careful about what you say to people, because off-the-cuff comment doesn't always land with patients.
And so that stuck with you and that influences how you lead today.
Yes, always be very mindful about what you're saying and who you're saying it to, because you never really know what a person's going through.
Even the best intentions can go astray.
Yeah, correct.
Speaking of saying the right things and being able to provide the right support to the right people, I'd love to hear about your experience in a hospital setting during COVID. Now, I know that COVID is kind of a time that none of us want to relive, but I think it does speak to your leadership, and that's what we're talking about today. So, do you have a story related to COVID where perhaps you felt like you needed to step up? What did that look like?
Yeah, COVID was a very difficult time for healthcare providers, doctors, nurses, managers. Constant communication was very important and keeping people updated. Back when it first started, it was a very scary environment. Our hospital took COVID patients and I was walking on the wards. One of the nurses stopped me and was quite upset, crying, saying, "Please don't make me nurse COVID patients. If I do, my ex-husband won't let me see my children moving forward," which was a very, very tough conversation to have. We were part of the healthcare network that had to see COVID patients. And at that point, I realised it was important for the staff to see me in there with them. So I got my PPE on and went in. I didn't realise how hot and uncomfortable it is to have PPE on for 20 minutes, let alone a full shift. But I went around with the nurses and talked to the patients and helped provide meals. To me, it's that leading by example in times of crisis is difficult. We also stood up a nursing home with COVID patients, so we had to send nursing teams to nursing homes to look after COVID patients. I would frequently go out and talk to the team and see how they were going, get my PPE on and talk to patients. I played a very small part in what was an amazing journey for those people. What our staff went through and what our staff did was amazing. It's one thing to be walking through a ward with your PPE on, talking to patients and staff. It's a completely different thing to be spending a 8-hour shift in the nursing home. I remember there was one gentleman who was a bit disorientated and he had to be separated from his wife because he had COVID and she didn't. He just wanted to get up, get out of bed, find his wife. He wanted to walk around, and our staff, with care and compassion, had to keep him in his room and help him, despite the fact that he was confused, get through that period of time. When you see people at their best, doing their best, it's a pretty amazing thing. That COVID journey is something that I will never forget. I remember when we had our first COVID patient come to the hospital, we had to block off all the corridor, block off the lift, and looking out through the window thinking, what does a COVID patient look like? And, COVID patient just looks like you and I. It was a pretty scary time, but I got to work with some amazing doctors and nurses during that time to provide care to those patients.
Knowing that our audience of listeners are probably going to be content and communications professionals or other leaders in health and highly regulated industries, what did that time leading under pressure teach you about effective communication?
It really taught me to listen. We had a job to do and we had things that we had no choices about, but to really take the time and listen to people and really understand their concerns and their fears. Facts are one thing, but the reality of it is that people have circumstances, not just at work, that are impacting how they're going at work, how they're feeling at work. So it was really about that, and just also being very clear, compassionate, understanding, and articulating that what we're doing was a good thing for the community.
Yeah, and I think a lot of people would agree that being a good listener is really important for leadership, but everyone might have different definitions of what good listening looks like. Do you want to break it down for me a little bit more?
I learnt during that time that the more time you take to ask questions, understand, repeat back to people what they're telling you so that they understand that you are listening is really important. Someone once said to me, you've got 2 ears and 1 mouth and you should use them in that ratio. So yeah, just asking lots of questions and really understanding what people's concerns are.
Thank you. I heard you say before a phrase, I think it was leading by example. So, what does leading by example mean to you?
Yeah, I think I'm not a clinician. And so really understanding what staff, not just clinical staff, but all staff go through. I used to spend time on the wards with the nurses and patients. I remember a particular time the nurses put me in charge of a lady who wanted to go home. She thought her daughter was coming to pick her up and she was on what we call an alert mat because she was a falls risk. And so every time she got up, the alarm rang and you went in there. I spent the whole 4 hours backwards and forwards to this lady, calming her down, going into the kitchen and looking at how they serve their meals. I used to call it not so undercover boss. I would try and spend time in all departments, understanding the jobs people do and the challenges they face. And some of those challenges you might be able to fix or make a change in what happens.
I think it's really meaningful what you say around showing up, because other people, when you're a leader, you might not realize people are watching you and they notice these things.
Yes, correct. I used to try and walk around the hospital a few times a week, and no matter what was going on, I would put my suit jacket on and put my smile on and head out. When I was walking around, I would pick tissues up from the floor and those sorts of things. What you walk by is what you accept. So I would certainly do that and go in and say hello to patients and ask them how their care was going. I remember one day I was at the cafeteria and there was a gentleman in his hospital gown and the back hadn't been done up properly. I said to him, "Oh, hi, I'm David. Let me give you a hand so that your backside's not showing." It was a casual thing and I did the back of his gown up. He sent an amazing letter to my manager about that small interaction. And it was a very small 5 minutes, but it just goes to show that the little things you do have a big impact on people.
I would love to ask if we remind everyone you're portfolio executive. So, as you're not a clinician, really what you do day to day is ensuring the commercial viability of the hospitals to best serve the interests of patients. How do you communicate, balance those hard commercial realities while also trying to gain the trust of your clinicians and patients?
I've been very lucky in that I've had some amazing directors of nursing who I've worked with who help me keep that balance. But the balance between profitability and patient care is always a challenge in any private hospital setting. But I also believe that if you're providing good patient care, they'll provide good feedback to their doctors, they provide good feedback to staff, and that in turn means that the doctors are happy to trust you or your hospital with their patients and potentially bring more patients. Ensuring that you're providing a good service and a good working environment for your staff is key to maintaining a profitable hospital. If you're providing bad care and your staff are unhappy, then the doctors will be unhappy and may potentially go elsewhere. So really it all starts from that.
By investing in good people, good practices that result in good care, what you're saying is commercially it comes back to you in the end.
Yeah. And the industry has challenges around models of funding and those sorts of things. But on a ward, a nurse doesn't really care about what the hospital's being paid necessarily. They care about having enough staff and the right equipment and the right environment to care for patients.
Have you ever had a difficult conversation with someone who is involved with the funds for the hospital or other commercial realities related to the hospital that you've had to try and overcome?
I've had lots of interesting conversations with that, probably primarily around getting appropriate equipment for the hospital. So if you want to provide a new service, for example, or an upgrade in the service that you're providing, you've got to provide a business case for that. And that can sometimes be a challenge because the business case may not necessarily stack up, but it's a good thing for the community. One of the hospitals I worked at, we had a radiation oncology bunker built in the building. And that wasn't just a clinical, that was getting it through council and all that sort of stuff. It can be a challenge providing new equipment or new services to a hospital when perhaps initially those business cases don't quite stack up.
And so, how have you managed to get them in the end? Was there any strategy, for example, that patient stories work really well, or maybe there's a certain language or phrasing that always gets someone's interest?
I think patient stories are really important. When you explain that a patient has to go to another hospital to get those services, you would much rather be able to treat your patients with all the services inside, especially from an oncology point of view. Don't want an oncology patient having to jump in an ambulance to go somewhere to get treatment and then come back. Also, the doctors are very important in that, and their stories and their reasoning, because their reasoning will generally not be financial. It'll certainly be based in patient care. So using all those things certainly help.
Yeah, that's a
Sometimes,
really good idea, actually. So, to be able to create a compelling business case, if you can get doctors on your side to talk about the health impacts and then put on your portfolio executive lens around, well, this is the actual cost if we don't do this, that the patient will need to go elsewhere. That's an interesting way to look at it.
sometimes you've got to use if it was your mother or father who was the patient, or your sister or your brother, what would you like for them?
Wow, that's really good to know and a good way to reflect. Do you think that storytelling is effectively used alongside data and numbers to explain ROI in these kinds of settings?
I think at a hospital level, it certainly is. I think as you try and explain these things up through the channel, it's probably not used as much. Most people who work in healthcare understand what we're there for. And so it certainly helps, but sort of patient stories and patient journeys, probably the higher it gets up the ladder, the less that conversation happens.
Would you like to see that change?
Yes, I think having worked on the floor and understanding patient needs is very powerful. Sometimes clinicians get frustrated by administrators that perhaps we don't understand what it's like on the floor to be with the patients. I think for me personally, having made that journey from being on the floor with patients really helps my understanding.
You've touched on a really good point because often leaders in healthcare, maybe they've climbed up the ranks from originally a clinical setting. And so, with that in mind, knowing that might impact how someone approaches a certain problem, what thoughts do you have on leaders and their backgrounds and how that impacts innovation at hospitals?
Yeah, my experience is that most hospital managers have a clinical background, which I think is really good. If you're like me and you don't, you need to surround yourself with strong clinicians. I've been very lucky over the years to have worked with some really strong clinicians. There's that happy balance. There's the commercial acumen that someone from a background like mine, which is I've got an accounting degree and those sorts of things, bring. And then there's the opposite side of that equation, which is the clinical knowledge and acumen that someone with a nursing background brings. So I think those two skills complement each other in the private setting.
I guess what it comes down to is making sure that those from diverse backgrounds get to share their 2 cents to create a well-rounded solution to a problem. While some of us might think there's one group that's the loser and one group that's the winner, or whoever's voice is the loudest is going to get their say, your perfect world is where clinicians and those with other skills and knowledge, such as numbers, accounting, administration, where they can all come together to play to their strengths.
One of the hospitals I ran had an emergency department. And if a patient comes in and requires a procedure, it's quite expensive for the hospital to bring in a theatre team to do those cases. And basically trying to balance that convenience, if you like, because it's obviously not ideal to be bringing in people in the middle of the night to do a procedure that is maybe not needed right at that point in time. So we got together with some doctors and nurses to talk about the criteria for a patient, for us to open theatre and treat that patient, because sometimes it might be convenient for the doctor to perform that procedure, but might not be ideal from financial point of view. So we put some criteria around, patient selection. If the patient could wait to be operated on in the morning when the theatre team are in, people are refreshed and ready to go, because it's not just a financial burden of opening a theatre in the middle of the night, it's also a drain on your staff. The hospitals that I've worked in have been private hospitals, so lots of this is elective surgery. sitting down with the clinicians, the craft group leaders, and talking about what the criteria is when a patient comes in to open theatre and do an emergency procedure. It's never as cut and dry, but it helped us get an understanding from a doctor's point of view, the financial impact and the impact on our staff, which helped their understanding, helped our understanding around what's needed from a clinical point of view. So we got to a nice situation where if a patient urgently needed that procedure, we would open the theatres. If they didn't need that procedure urgently, that patient would be moved on to potentially another doctor's list in the morning.
With everything that you've shared with us today, if you had to boil it down to 3 key principles of communication that you stand by every day, what would those 3 be?
I think being very clear is important. Being very calm. So we had a situation at one of the hospitals where we had to evacuate the entire hospital. And that's a very high pressure, high stressed environment. And people are looking for leadership and communication that is calm and relaxed, no matter what the situation is. I think that's something that I've always tried to display, is regardless of the situation, remain in control. Certainly trying to be a good listener and understanding the problems before you come to a solution is important. I also think that being able to say, I don't know, let me have a think about it, or let me find out, is very important. As leaders, we tend to think that we should have the answer to every question and every problem that comes across our desk, which is not possible. Being able to take that time to work out how you craft the story is very important, and engaging people around you who potentially have a different view is also important, because the best solutions come from collaboration.
Have you ever lost your cool at work or flipped out, David?
Oh, that's a good question. I am sure I have, but I've probably done it in the comfort of my own office. It's probably say that there is very few people who have seen me lose my cool at work. Most people see a very calm, relaxed point of view, but yeah, we all get to the point where we're a bit stressed out. I try and keep that to a minimum. I try and buy myself some time if I feel myself getting agitated. Let me come back to you with that, or let's talk about that later. You'd have to ask my colleagues.
And what would you say now if you could travel back in time and speak to 20-year-old David?
Yeah, probably just really enjoy the time that you get to spend with your colleagues, because it's changing all the time and you get different jobs, new jobs. And some of the people that I've met throughout my career are lifelong friends because of the experiences that we've shared.
Oh, thank you for sharing that, David. We've had some incredible takeaways from you today. I really appreciate it. And, leadership isn't just about having the best strategy. It's also about making sure you bring that human touch to everything that you do. So thank you so much for your time, David.
Thank you, Natalie.